Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and I want to talk to you a couple of minutes about ASLMS, the American Society for Laser Medicine and Surgery. This is a fantastic group of people, and if you do anything that has to do with lasers, lights, minimally invasive cosmetic surgery, the list goes on and on. This is a society you definitely want to join. I'm very proud to have been a fellow of this society for almost a decade now. And their meetings are great. Their annual meeting in the spring is really a conclave of the movers and shakers of laser physics, cosmetic surgery, laser safety, you name it. One of the real strengths about this group is the diversity. You have surgeons, family practitioners, you have dermatologists, ophthalmologists, oral and maxillofacial surgeons, plastic surgeons, facial plastic, ENT, general surgery, veterinary, dentistry, nursing, allied health, the physicists, the list goes on and on and on. And lasers and light-based therapies and all the new emerging therapies are so complex that you really, it's fascinating. I mean, you can never learn too much. It just changes so rapidly. So one of the big things that we do in our practice is laser resurfacing, and we have several lasers in our practice for spider veins and keloids and lasers, and it's a big part of my practice. And I really learned a lot about laser surgery and honing my skills in laser safety from this organization. So if you're not a member of ASLMS, this is a group that you want to join, and hopefully join us for our annual meeting this spring. What I'm going to do now, because I often get asked, well, what kind of things do you do with your laser? So we're going to show you a little sampler of some of the laser surgery that we do in our office. And again, aslms.org. I'm Dr. Joe Niamtu, LoveThatFace.com. Resurfacing, I'm not worried about a transition or about feathering the procedure. And my goal is to try and not have any significant underlap or overlap, but to have the patterns right next to each other. Elman laser. This is the erbium, and I have this at 800 millijoules, and it is a situation basically where you can do this awake. This is really a painless situation. I'm going to show you on my own hand, so there's really no pain with it. And that's what's nice about the erbium laser. You can expeditiously treat the undermined skin. So we're going to keep our fluence where it is, but we're going to change our density to 4. And you can see that we're careful not to overlap here. So this is a lower density, the same power, and we'll do the same thing on the other side, and then we'll come back and talk again in a second. So we're making the laser incision with the CO2 laser. We're using the 0.2 millimeter handpiece at 8 watts, and it's a bloodless incision. And so now we're taking the skin off of the orbicularis oculi muscle, much like peeling a grape. And there's our skin removal, and now we will remove a strip of orbicularis oculi muscle. All right. And we'll removing a strip of orbicularis oculi muscle, and the next layer down will be the orbital septum. As we incise through the orbital septum, the fat pads come well into view, and we will reduce and conservatively recontour the fat with the CO2 laser. And the medial fat pad is very apparent. Okay. And the next step is to place 3 6/0 fast absorbing gut sutures. Face.com. Today we're using the Iridex laser with the 940 wavelength, and got my handy dandy light on, and we're going to do some spider veins here. And you can see the spider veins just disappear as we treat them. We usually do this under just topical anesthesia. This patient today is having some other procedures, so he's sedated.